Catherine Brazina with Kaiser Permanente, and I'm joined today by Robin Guenther. Robin is a principal at Perkins+Will, a leading research and design-based architecture firm. Robin is also a longtime advocate for healthier, healing environments and textbook author of sustainable healthcare architecture. Fast Company recently named her among the country's top 100 most creative people, and she's senior advisor to Healthcare Without Harm, which hosts the annual CleanMed conference for leaders in healthcare sustainability. And we are here at CleanMed today in Portland, Oregon, speaking with Robin about her work and the role of sustainability in healthcare design. So Robin, your background is in architecture, as I understand, but tell us a bit about how you specifically got into sustainable design for healthcare facilities.
I went to architecture school in the 1970s during the first energy crisis and studied sustainable design. When I graduated, my first job was with a healthcare design firm, and it was a little after the energy crisis was over. No one really talked about sustainability. At that point, people forgot about the energy crisis fairly quickly in architecture, and I spent about 15 or 20 years then honing the craft of designing hospitals before I really reconnected to my sustainable design past and brought that forward into the healthcare arena. I think when I first started that, it was considered quite controversial, and people didn't really know quite why I cared so much about that or believed it was the future. But I think we can all agree that it has become the future. So I think it was serendipitous to have this education on the one hand and then really a long career designing hospitals.
So it really has become a trend more in healthcare now to be looking at sustainable design for healthcare facilities. What other kinds of trends and innovations are you seeing in sustainable design for healthcare these days?
Well, I think after a long period of concern about whether we actually could design and operate low energy hospitals, there has been a significant shift. In fact, there's really a race right now to see who can build the lowest energy consuming hospital in the US. And that's terrific to see, because we all know that early adopters often are followed by this sort of chasm that people can't quite cross over. And so I think that the Targeting 100 study that was done by the University of Washington out here in the Pacific Northwest has really enabled that transference. And so I'm excited to see the first net zero medical office building, the first really low energy hospital come online using systems like ground source geothermal or renewable energy, solar, wind. It's really a very exciting time for energy. The next one, I think, is the complete blossoming of the material health conversation. That's a conversation that Kaiser has been engaged in from the beginning, as have I. And just seeing the leap forward in the last 2 years with the release of the Health Product Declaration, the ability to really begin to push manufacturers to disclose the ingredients in building materials voluntarily, and then it will present the challenge for all of us about what to do with this information when we have it, because we're just at the cusp of being inundated with loads of chemical reports and chemical reporting on content, and then we'll have to figure out how to make better decisions using that information. But that's likely to unleash just a really creative period in product reformulation, in innovation in the building products industry, unlike anything we've seen in my generation. So, I say bring it on. Let's see where we can get.
How much information can we gather? Yes. You've talked about and written about the importance of enhancing healthcare resilience in an age of climate change. Can you elaborate a bit about this concept and explain for our audiences what you mean by resilient healthcare infrastructure?
So climate change is, of course, the most significant challenge of our time. And whether or not you believe in climate change as a concept, there's irrefutable evidence that we're seeing much more extreme weather across the United States. So that means more intense episodes of weather for longer duration, and happening more often. So hospitals are really designed to continue to operate through what I would call reasonable weather stressors, but having new peaks, having more intense weather events is certainly challenging the healthcare infrastructure. And you need look no further than Hurricane Katrina or Superstorm Sandy in my city to see the really heartbreaking impact of what happens to communities when healthcare services are interrupted and hospitals need to be evacuated. So I think that resilient infrastructure is really infrastructure designed to withstand the future weather challenges, not simply today's. So really gaining an understanding of what's the weather scenarios in your climates for 2030, 2050, 2080, recognizing that when we build hospital buildings, we build them for 50 years. So looking at the end point of their life and saying, what will that look like?
What are the extremes?
What are the extremes? So for example, we're doing cisterns right now at the Stanford Children's Hospital, at the Lucille Packard Children's Hospital at Stanford. And when we suggested those cisterns 8 years ago, because of course we all know that in California it takes 10 years to build a hospital building, when we suggested those cisterns 8 years ago, people didn't really understand why we would be doing that. But the cisterns went in a few weeks back, and they are the most talked about element of the building, given the new predictions for Northern California drought. So I think we all have to, whether you're in the Kaiser facility department or you're in the design firms that service the facilities departments, everyone has to be future focused around resilience. You have to see the end game and at least get the physical infrastructure that will be impossible to change, that's baked into the building, responsive to the projected needs at the end of the building's life, not just at the beginning.
So how do you see all of these efforts going on in sustainable healthcare? How do you see them influencing other sectors, business sectors, design sectors, and helping those sectors to grow in their understanding of the importance of sustainability?
Well, you know, I certainly think one of the reasons that we have a sustainable design movement is that we were so off track as a society. And I think the reason we've been off track is because no one has really taken health into consideration in their built environment decisions, in their operational decisions, in their product design decisions. There isn't any sector in business today that has been focused on health as the inspiration for its innovations. And I think healthcare is uniquely positioned to demonstrate how you can transform practice when health is the aim. So I think we can model that for every other sector of the U.S. economy and for every other health system in the world. We need to lead on that. And I think we're in a good position to do that.
Great, great. Well, thank you so much for your time today. It's been a pleasure, and thanks for your wonderful inspiration and ongoing dedication to this work.
And enjoy the rest of the